I'm Gina Ryan, Director of Hardin County Educational and Community Television, and welcome to this edition of EC3 HOSA Medical Moments. Each month we try to bring you topics and issues that are relevant to us on a daily basis. And right now we are fighting a battle with opioids and fentanyl use. And it's rather scary, and it is life or death in many occasions. Joining me today is Jennifer Osborne, and she is with the Lincoln Trail District Health Department, which oversees a number of counties. And Jennifer, before we jump into our main topic, tell our audience about yourself.
Sure. Again, I'm Jennifer Osborne. I do work for Lincoln Trail District Health Department as a harm reduction manager, and I've been working in public health with Lincoln Trail for 19 years now. I started in health education 19 years ago, and during those 19 years I've done a lot of different programs. I've worked in a lot of different programs, whether it was working in school settings with prevention, or just out in the community doing tobacco cessation and those types of things. But for about the past 4 years, I've been working in harm reduction with Lincoln Trail, and that term may be new to a lot of people, but the concept isn't new.
I was going to say the term again, slower so people hear that.
Sure. It's harm reduction. And in terms of substance use, when we look at harm reduction, it may be things like increasing access to naloxone for individuals that may be using. It may be access to syringe service programs, but harm reduction is not a new concept. Seat belts are harm reduction.
Right.
So, I feel like it's just kind of been termed a little bit different. And some of those things, some of the concepts that we've been using in harm reduction in Kentucky are new to Kentucky. For instance, the syringe exchange programs are new to Kentucky, so people are not as familiar with that terminology.
So Jennifer, what is the role of the health department in regards to fentanyl and opioids?
The health department's role, and not just with fentanyl and opioids, but our role in general for public health is to prevent, promote, and protect our population and the health of our population. In terms of how that looks for fentanyl and opioids, prevention can come in a lot of different forms. For instance, with the health department, our HANDS program for first-time parents, that's prevention. Mm-hmm. Creating a family dynamic that nurtures and creates those protective settings for children. That is prevention, not just when it comes to substance use, but a lot of different things, child abuse, and it promotes a lot of good health outcomes. But there are other things prevention-wise from the health department standpoint with fentanyl and opioids. There are school-based programs that we have employees who work in schools and provide evidence-based curriculum around substance use and drugs. And prevention can also come in the form of, one of the things that we have done here in Hardin County is we've worked hand in hand with the Hardin County Coroner's Office to establish an overdose fatality review team here in Hardin County. And it was the first one in the state of its kind. But that team looks at overdose fatalities. And it is an interdisciplinary team, so a lot of different people from a lot of different organizations and sectors in the community. For instance, law enforcement, our court system, all of those folks are members of that team. And what we do is, when there is a fatality, we do look at that person's life, what led up to that overdose fatality, and look to see if there are gaps in our services as service providers that occurred where we can maybe go back and say, hey, what can we do better? What can we do to prevent this gap from happening with another individual? So that's a prevention piece. When we look at promotion, widespread education, whether that is in the form of media, whether it's that education in the school setting, in our community settings, with employers, we do a lot of that education, as well as advocating for policies. Policies such as access to syringe service programs in our communities. That's a policy change. Policies at the state level that promote access to Narcan or naloxone. It promotes access to treatment for individuals who are seeking substance use treatment. And then protection in this instance, providing those syringe service programs where people who are actively using can come into those programs and receive services without judgment, and hopefully link them up to treatment as well if that's what they're looking for. And as well, increasing that access to Narcan in our community.
You know, we have been in this battle with opioids, this war against opioids for decades.
Right.
And so what makes fentanyl and opioids, well, first, why is it so attractive and why is it so dangerous?
Fentanyl has become an illicitly manufactured drug. Fentanyl itself is used in medical settings, and that's pharmaceutical fentanyl.
Right.
And it has a place in those medical settings for people for whether it's pain management purposes. I mean, it's used as an anesthesia as well. And those are safe forms of fentanyl. But now we have this illicitly manufactured fentanyl that is out on the streets in the drug market, and the big issue is nobody knows how potent it is. You know, they say fentanyl is 50 times stronger than heroin, and that is the fentanyl that is pharmaceutical. We know that is pharmaceutical grade fentanyl. And unfortunately, all of the fentanyl that's out on the streets, we have no idea the potency, and because they are illicit drugs, we don't know what it's in. And that's really the scary part, is because people who may not be seeking fentanyl, and a lot of people are not seeking fentanyl.
Right. It's not like you have your fentanyl today.
Right. So, you know, if you have someone who has been using methamphetamine now on the street has fentanyl in it. And that's one of the biggest issues, you know, when you have youth who may be experimenting with drugs, and they don't know what they're getting. They are being sold something. They're being told that this pill that they're going to take is a Percocet or a Xanax, and it isn't. It contains fentanyl, and that's really where the issue is coming from. And
from one-time use, you could overdose.
Absolutely.
Okay, and why is that? Is it because, well, you said it was so strong and things, but again, what causes that individual to go into overdose mode? Or
it's the strength of what it is they have taken, and combined with, you know, that person's body type. You know, it's really kind of individualized, and you know, one person may take a pill out of this batch of drugs, and another person may take that same pill out of that batch of drugs, and it may affect them differently. It could be because of their body type. It could be because this pill has more fentanyl than that pill has. So it's really, there's so much unknown, and that's why it's so scary.
And when did that spike in Kentucky, fentanyl being available?
So in Kentucky, we really started to see an uptick in fentanyl about 2019, right before the COVID pandemic hit. There was actually about the period of 2017, 2018, where we were starting to see declines in the numbers of overdoses. And then the illicit fentanyl hit the market, and those numbers went up. And then we included COVID into the mix, where people were more isolated, maybe didn't have access or easier access to substance use treatment programs. So it really was, it was a terrible time. And unfortunately, we're still dealing with fentanyl.
And what ages are involved?
Every age.
Every age, right?
Every age is involved. And I started reading a little bit the other day, and one of the age groups where we're starting to see more overdose deaths related to fentanyl is that 14 and up year old age group. And again, it's because of that access to those pressed pills. And right now, the majority in Kentucky, what we've seen as far as overdose fatalities, it's kind of been that 25 to 34 age range has been the majority, but there's no age range that has not been affected.
I was going to say, it's all over the board there.
Right.
And any death by overdose is,
Absolutely.
I mean,
It's too much.
Exactly. Is fentanyl one of those drugs that you get hooked quickly? You mentioned heroin, and heroin's highly addictive. Mm-hmm. So is fentanyl as or more in terms of addictiveness?
I would think at least as addictive as heroin. When people start to have that fentanyl use, then it is one of those things that they do start to seek out. Just because of the withdrawals from fentanyl can be very, people get very, very sick from those types of withdrawals. So, once people have started getting that fentanyl into their drug supply, they develop that tolerance and they seek the fentanyl at that point.
What are some signs that, for parents, what are some signs that your child might be using? Opioids to begin with, but then also the fentanyl aspect, if there is a difference in those looks.
I don't know that there is necessarily a difference from fentanyl, the signs of fentanyl, as there would be for other drugs. We do tell parents oftentimes, look for the same things that you would look for if you were looking to see if they were using tobacco products or whatever. So looking to make sure, number one, who's your kid hanging around? Have they had a change in the group of people that they're hanging around? Is there a change in their behavior? Are they more isolated and seclude themselves from family and or friends? Change in their behavior at school, their grades. Look, all of those changes sometimes are difficult to see because they may be small, and kids are good at hiding things. But telling parents to be as involved as you possibly can, and don't be afraid to ask for help as a parent. Mm-hmm. Not just help for your kid, but help for you as a parent, because there are so many support systems out there for parents and for kids. And this is not an issue that it doesn't discriminate.
Right.
It doesn't discriminate at all, and it's not hitting one group of people any harder than it's hitting another group. And just parents need to be very aware. They need to educate themselves about fentanyl, and then they need to give that education to their children as well.
What are some areas where they could get that information?
One place that is a good, credible place for information is the DEA, the Drug Enforcement Agency. They have a program called One Pill Can Kill, and on their website they have a lot of good information for parents on things to look for with their kids, not just those behavioral types of changes, but if you're looking at you're monitoring your kids' social media, which is a good recommendation. There are things to look for in those social media posts from kids, emojis, and certain things to look for that may show that your kid is using drugs, seeking drugs, potentially trafficking drugs. So the DEA is a really good resource for people to check out just because of that campaign that they have. And it's really specifically targeted toward youth because of that one pill can kill.
With the understanding, a number of people get introduced to these drugs, let's just say painkillers, because of an accident, an injury, something that is clinically ongoing in terms of pain. And we've seen large pharmaceuticals charged by our government against the push of those. So in a way, could parents be introducing the drug at home to their children?
Sure.
Not knowing.
Not knowing, right. And another recommendation is if you do have medications, keep them locked up. Because some people do have legitimate reasons why they may have these opioids in their home. And keeping those things locked up, out of reach, out of sight, is definitely a good recommendation for parents, for grandparents, for anybody. Keep those things locked up. If you have those items in your home that have expired or you no longer need, there are prescription drop boxes in all of our counties. You can go to our website to find the locations of those prescription drop boxes where you can just take and dispose of those pills, and they're taken and disposed of safely.
Is the cost of let's just say the street price, is it appealing to children or teenagers, or is it expensive?
It is appealing. And just because the supply is so large right now, so it is fairly inexpensive. I don't know the going rate for those things right now. That would probably be a law enforcement question, but it's very easy to get.
Right. And so, again, parents, just pay attention, or guardians, grandparents raising their grandchildren, just be aware of just things that you notice about your child, especially.
And a lot of it is being sold. Those transactions are being made on social media.
So they can't, doesn't that even make it a more, the person that is doing that, the crime of that is more stringent, right?
Right, for the traffickers, yes. And if someone who has been trafficking in opioids or fentanyl, if law enforcement can trace a death back to a specific trafficker, they can be charged with murder.
Oh, great. You mentioned be on top of be aware of what your child, your students are doing. However, you could have an older parent that may also be using, and that might be a gateway. I guess, we always think that, they'll never smoke pot if they didn't smoke cigarettes. So what's the gateway to these painkillers?
Oh, goodness. Honestly, I think the gateway in a lot of cases is some type of trauma that somebody has experienced, whether that is abuse, whether it is they are living in poverty, they are living in dire situations, or they've had an accident where they've been exposed to painkillers in a legitimate way, and then that supply is cut off because whoever says they don't need that prescription anymore. I think that really the gateway at this point is people's surroundings, the environment that they have been raised in, the environment that they currently live in. So increasing protective factors around kids, and whether that's happening at home, it can happen at school. Make sure that kids are in surroundings where they feel supported. And that's the same for everybody. We all want to have those basic needs met. We need those basic needs, not just food, water, and shelter, but, a trusting person that we can talk to. All of those are needs that we all need met on a daily basis. Recently,
within this past few months, the city of Vine Grove has gotten Narcan dispenser. Am I saying that correctly?
And yes, we did work with Vine Grove Police Department on implementing a Narcan vending machine. It's called vending, even though there's no monetary transaction there. Increasing access to naloxone is very important.
And what does that do?
So naloxone is an opioid antagonist. What that means is it goes, and if somebody has experienced an overdose from opioid, and that can be fentanyl, any type of opioid, if they're experiencing an overdose, what the Narcan does is it blocks the receptors in the brain. So the opioid sits on those opioid receptors, and what the Narcan does is it knocks the opioid off of the receptors, and it sits on there and it blocks it so that the body has time to metabolize the drug that they have taken. It is basically a life-saving medication for somebody who's experienced an overdose. It is recommended that everybody carry Narcan. Anybody can. The law in Kentucky says anybody and everybody can carry Narcan. They're not going to be charged with any kind of criminal activity just because they're carrying Narcan. The law also states that anybody can administer Narcan to another individual without fear of criminal or civil liability, as long as they're acting in good faith to save that person's life. There are no side effects from naloxone. I could give it to you right now and you would have no side effects at all, because if you've not taken an opioid, there is no effect. So it really is a life-saving medication. We recommend that everybody carry naloxone with them, because you never know when you're going to be in that situation where you could potentially save a life.
Do you get that at your pharmacy, or where would you get that?
Yeah, so there are obviously places like the vending machine in Vine Grove where it's available. Here in Hardin County, I'm pretty certain that the apothecary pharmacies have some grant-funded Narcan, so people can go in. But every pharmacy you could walk into and say, hey, I need to get Narcan, and they should be able to work out that process with you. Most insurances do cover the cost of Narcan. I know Medicaid covers it completely. Some insurances, there is a copay. Just some private insurances have that copay, but Kentucky has a copay abatement program that helps to cover that copay if you've had to pay it up front.
Well, just having it, just like you said, if you have it, let's say you come upon someone you don't know, but what are the signs of an overdose?
Okay. With an opioid overdose, we tell people to look for potentially the blue coloring around lips, fingertips.
So oxygen type of thing?
Right. If they are not responsive, obviously, if you can't get them to respond to any kind of stimuli, then that is a sign of overdose. If a person's having difficulty breathing, obviously you're probably not going to take their blood pressure at that point, but it does cause drops in blood pressure and heart rate as well. Our recommendation, though, to anybody is, if you suspect somebody has overdosed and you're not getting a response out of them, give the naloxone. It is not going to hurt them. And it can be used on anybody, whether it's elderly, children, a pregnant woman. It can be given to anybody.
And is it an injection, and where should you use that?
So there are different forms of naloxone. There are injectable forms. The majority of what's being given out to just lay rescuers is a nasal spray, a 4 milligram Narcan nasal spray. So basically you insert it into their nose, fully insert it, push the little plunger, and they're given the dose.
Okay. What can schools do a better job at? Trying to do what they need to do.
Schools have so many things to do. And, I hate to even say, well, schools can do better at this, because they have so much on their plate. And I don't think it's just up to schools. It's up to everybody. It's up to us at the health department. It's up to law enforcement. It is up to schools, because you do have access to kids all day long. I would think one thing that schools can do is allow that education to be given to students, not just education about substances and fentanyl, but just education, period, about coping with whatever has happened in their life, education about how to refuse somebody that's offering you drugs. So just being open to those types of education in the school. I know that the time in their day is limited. I fully understand that, but if kids aren't healthy, they can't learn.
Right, you're definitely right there.
Yeah.
Can parents, I just say that there's a stigma. A lot of times a parent may not seek help because they feel, oh, I'm a bad parent, or what do I know? And sometimes you do get to a point where you don't feel like there's anything else you can do. So it's like a hard lesson type of thing, but they really need to keep trying, wouldn't you say?
Right. There is such a horrible stigma around substance use and mental health, period. And I would find it hard to believe that anybody hasn't been affected by one or the other at this point. And one of the things that we can do, not just as parents, but all of our community members, everybody can work to decrease that stigma. There is nothing wrong with asking for help. It's difficult to ask for help, but there are so many good resources and so many good programs, so many good organizations in our communities that can help. So, just taking that first step and saying, man, I don't know what to do with my kid right now. I don't know what to do. And it's okay to say that. Nobody, anybody that you are seeking help from they're not going to judge you at that point. It's just, that is a difficult step for a lot of people.
You want to be there rather than, I should have got help.
Right.
So you don't want it to go that far. So thank you so much for coming in. For our audience, again, where can they get additional information?
Sure. You can go to our website, which is ltdhd.org. Or if you don't have access to internet, you can certainly call your local health department. We'll be glad to share as many resources and as much education as we can with you.
Well, and I'm sure those at home too, do contact our school nurses in Hardin County Schools. Also, we do have psychologists, those that are working with mental health issues also on a regular basis in our schools. So thank you for all you do and for the Lincoln Trail District Health Department and all it does in the many counties. And those of you at home, look around. If you can make a change, do so, and possibly get Narcan in order to help if you do come across that situation. So thank you again, Jennifer.
Thank you.